Hi, this is Christian Jensen with ABC Healthcare. I'm on the streets of Salt Lake City, Utah at the Gateway, and I've run into a couple great people from Missouri. And what's your name, sir?
My name is Michael Carr.
Michael Carr, and you're?
Jerry Carr. We have a son-in-law who is going to become a doctor next year. He's finishing his 5th year of residency. And he's really worried about how he's going to pay for what it cost him to go to school if all of this goes through with the new health care plan, because the doctors aren't supposed to make any money according to that plan. We have another son-in-law who will begin his 3rd year of medical school next year. He also will be facing the same problems and worries. So we don't know what's going to happen, but we're praying really hard that Americans will stand up for their rights to the health care we have, which is wonderful, and address the problems we have, not make more.
Okay, what do you guys think about government involvement in the health care issue at all?
I believe that the government should stay out of it.
Well, I echo that, and even though I did work for the government, I can say that anytime that the government gets involved in anything, you're better off. We were better off not being in it at all. Yes, I realize that there are some folks out there who are having some real tough times right now. I know that unemployment is real high, and that's what I dealt with for 30 years.
Sure.
And it's a tough way to go. But I also realize that there's a next generation coming on that is going to have to pay for all this. 2 or 3 generations. If we and I know it's going to be right. Taxes are going to be raised somewhere or another. Anytime you get more government involved, you can plan on that.
You don't get something for nothing.
And if a lot of us already had decent health care, it's how you pay for your health care. And I know some folks who are, quite frankly, part of it is the high deductibles. That's really hard for them to pay, high premiums and high deductibles. But those folks already have insurance. I really do feel for those who don't have any at all. And I feel like that, I guess out of the humanitarian in me, I couldn't ever turn anybody away.
Sure.
if they're for that.
But we feel that that's what needs to be addressed, is those who don't have health care and need it, not disrupt and change and destroy what we have. It's the best in the world.
Okay, let me switch gears a little bit and ask you this. What would you think if we could bring healthcare back to how it was in the 60s, where you actually had it between your relationship between you and the doctor, and the doctors were able to make the decisions, not the insurance companies, and kind of what are your thoughts on that?
Okay, well, it's been a long time since the 60s, but since I was probably still at home then, but that sounds like a very good thing, because the relationship between the patient and the doctor has to be a positive thing. If you have a third party, anytime you have a third party involved in anything else, and who really doesn't have any idea what's going on, especially if it's going to be government people telling you, yeah, you can do this or do that or something else, or insurance folks, healthcare goes down. The quality of the work goes down, because they can say, well, your policy only covers this, so I can only do that.
Yeah, and so if the doctor feels like there's a procedure that needs to take place, or it's his expert opinion that he needs to take care of this person this certain way, and that decision is taken away from him because the insurance companies don't cover that, or they decide they have an expert opinion on something that they're not experts on. Do you see that as a conflict in any way?
Yes, and we got one of our own daughters went through a period of when her husband was in school and didn't have insurance. He had insurance through the military for himself, because he's a veteran, even though he's so young. And she had no insurance. So she bought insurance, what she could afford. But the deductible was $1,000. In a year's time, she never used that much up, and so she ended up paying for everything herself. So why have it?
Yeah. Okay.
I guess the thing that would be, I think we all need choice on what we want. If a person chooses not to have, then so be it. But we also ought to be able to choose all over the country whatever would be best for my needs.
Okay.
Not necessarily the cheapest.
Yep.
Cheapest isn't always the best.
Yeah, right now you have to stay within state. You can't go across lines.
That's what it is with us.
And that's not
us.
right.
I have to accept what's offered in my state.
Well, you guys, I really appreciate your time. That's nice of you to let me just pull you right off the street, and you're visiting here from Missouri, and we hope you have a great time, and so thank you very much.
We put a lot of prayer and thought into this because we're worried about our country and about our people. We know a lot of people who don't want health care because they handle it on their own. We know a lot of people who'd like to have health care that don't have any way to get it. We are grateful for what we have. We don't know how long we'll get to keep it if this situation goes on.
Beautiful. Well, thank you so much for your time. This is Christian Jensen with ABC Healthcare, The Voice, and we appreciate these guys' time. Thanks.